Hey guys, as promised, I just wanted to finish up the electrical stimulation module, and man, oh man, have we covered some awesome electrical modalities. I'm hoping that now you have a better understanding of how to use and apply the different types of electrical modalities to your specific patient population. I always end the module talking about combination. Combination, as the name implies, is going to be a combo treatment using both ultrasound and electrical stimulation. So now that you have background in how to use therapeutic ultrasound to gain or to create physiological responses, and now that you've just learned the different electrical stimulation techniques and how to adjust parameters to again get the desired physiological responses, now we can kind of talk about how to use the most frequently used therapeutic modalities, that being ultrasound and electrical stimulation, to create a desired physiological response in a certain subset of patients that present in our clinic. So historically speaking, ultrasound and electrical stimulation have long been applied concurrently. And when they have been applied as a combination treatment, they technically have been used to either treat a patient who has trigger points and or muscle spasms. And in some ways, they've also been used to treat patients who have, let's say, pain that originates from superficial painful areas. And so the most common treatments that you will use a combination treatment on would be a trigger point or a muscle spasm in a patient who presents to you in your clinic. And so just a little bit of background on the actual modality itself. Man, I wish we were in class so I could actually show you how this works, but I will attempt to explain it thoroughly enough so that when you go into lab, you have a great understanding. And so in this particular technique, the ultrasound head, which is here, right, is going to serve as your active electrode, right? So it is the active electrode. It is the electrode that is going to be, guess what? Delivering the electrical current to the desired treatment area. Now, keep in mind that your ultrasound head is also going to be what? Emitting or transmitting ultrasound waves. And if you have a continuous ultrasound treatment, then you are going to be doing what? Heating your patient. And if you have a non-thermal ultrasound treatment setup, then you would be maybe working on fibroblastic repair, collagen synthesis. But for the most part, when you do a combination of ultrasound and electrical stimulation, most of the time you want a thermal ultrasound setting because that heat is going to help reduce tissue resistance, which will be good in terms of aiding in delivering the electrical stimulation to the desired trigger point and or a muscle spasm. And what you also have with combination is that you have to complete the circuit. Since this is an active electrode, we also need an inactive electrode or a dispersive electrode pad. And Dr. Gans, again, will show you how to use this particular modality in lab next week. So as mentioned, the output parameters for ultrasound at least would either be non-thermal or thermal, but most times you really want that thermal ultrasound, again, to reduce tissue resistance, which would aid in the delivery of the electrical stimulation that you choose for your particular patient. And then as it relates to your actual electrical modality, I would probably pose this question to the class right now. Which of the modalities that you've learned would or are awesome for reducing muscle spasm? And I assume that you guys would probably say maybe biphasic would be really good. Maybe Russian pre-mod could be good if you're putting it directly over the motor unit, right? And you want to make sure that you're at least at about 60 to 80 pulses per second so that you can really get muscular tetany and hopefully cause that muscle to either fatigue and to relax. One key thing to keep in mind when you're dealing with or treating trigger points is that trigger points and other stimulation points display what is a decreased resistance to electrical current flow. So you have to make sure that you are manipulating both the phase duration and you have at least a moderate pulse frequency of at least 50 pulses per second, if not greater, to really aid in producing what is called a strong muscular contraction. And when you do that, then those muscle fibers within the actual trigger point itself may fatigue to a point to where they no longer have the biochemical ability to create a spasm. So basically they lose the fight, they give up, and that trigger point releases itself. What we also know is that low amperage electrical stimulation is capable of increasing that ATP within cells, and so that increases their ability to repair themselves We also know that with this treatment that we have increased phagocytosis if we're thinking about a non-thermal ultrasound treatment. So there are lots of benefits to the use of combination of electrical stimulation and ultrasound, as long as our treatment parameters are set correctly. Remember, I said in class, you are the chefs. Now that you know all of the parameters that can be adjusted, you just have to adjust them so that it benefits the patient sitting in front of you. So as we complete this module, as I said, there were at least 6 different electrical modalities that you learned. And then in addition to that, we've talked about combination treatments, right? So the first one that we just talked, the last one that we just talked about is the combination of therapeutic ultrasound and electrical stimulation. But we also talked about hand stim, right? Using your hand as a massaging tool to introduce electricity to the skin. And we've also talked about, using ice or water immersion as the patient is also using electrical stimulation. So there are lots of combination treatments that can be used concurrently with electrical stimulation. Again, it's going to depend on your patient's signs and symptoms, right, and how they're presenting to you. But most importantly, what your selected treatment is going to depend on 2 other things. Number 1, the type of injury or pathology that you're trying to treat. And then I would say probably even more important than that would be the phase of injury that they're in, right? The phase of injury is going to drive probably the electricity intensity, but it also might drive the frequency that you set your electricity or your electrical stimulation at as well. So when we think about the type of current used, right? So the type of current could be Russian, biphasic, IFC, pre-mod, high volt, right? The list could go on. What you want to do is you always want to be able to provide a rationale for why you chose what you chose, and you can do that based on the parameters that you used when you were treating that particular patient. But it also has to do with what are your desired physiologic effects, right? If your desired physiological effects are neuromuscular electrical stimulation, right? So stimulation of a muscle, let's say post-surgery, then we know by far that biphasic and Russian are probably going to be the 2 best modalities to use, right? If your goal is to control edema, right, limit it from forming, then we know that high volt is probably going to be the best modality to use. If your goal is to reduce pain in a patient, depending on the size of the treatment area and your treatment goals, you could use TENS and or IFC or pre-mod. So you always want to have a rationale. You always want to consider what the physiological effects are that you want to occur, and then based on that, you can manipulate your specific parameters. So I hope, all in all, that this was a beneficial module for you. I'm hoping that as athletic trainers, as physical therapists, that you would be able to take this knowledge and apply it into your clinical practice, either in graduate school or as you become clinicians when you graduate this current school year. Thank you for your time. This will end the electricity module. Please do not forget that you will have an optional lab with Dr. Gans on Monday in the clinic, and that will be going over kinesio tape. And you also have a parameters homework assignment where I'm asking you to take every electrical modality that we've talked about in this module, and I want you to go through and write out all of the parameters and the goals based on those parameters. More to come in an email. Thank you for your time.